Hi everyone, this is Ashwini. Welcome back to my YouTube channel Adunia Nursing Classes. Today I am going to discuss with the prolonged labor. The name only indicates that prolonged labor means the labor is said to be prolonged. The prolongation may be due to cervical dilatation in the first stage or inadequate descent of the presenting part during the first or second stage of labor. And also inefficient uterine contraction can be a cause of prolonged labor, and also the labor may be also prolonged due to pelvic or fetal factor. Next, coming to the exact definition of the prolonged labor. The labor is said to be prolonged when the combined duration of the first and second stage is more than the arbitrary time limit of 18 hours. It means when normal labor is characterized by the presence of regular uterine contractions will be there with well effacement and dilatation of the cervix with fetal descent. This is normal labor. There may be variations occur in prolonged labor. It may takes for the time limit of more than 18 hours. In normal labor, first is the average duration is 8 to 12 hours in primigravida and 6 hours in multipara. In second stage, the average duration is 2 hours in primigravida and 30 minutes in multipara. If it takes more than 18 hours, it will be a prolonged labor. Coming to the next slide, that is latent phase. Here, latent phase means it is the one of the preparatory phase of the uterus and the cervix before the actual onset of labor. It means in active stage of labor, there will be a cervical dilatation is more than 4 centimeter and the strong regular contractions will be there. In latent phase, the cervical dilatation is 0 to 3 centimeters and irregular contractions will be there. Normal latent phase is about 8 hours in primigravida, 4 hours in multigravida. Coming to the next slide, prolonged latent phase. A prolonged latent phase, one of the abnormal condition of the mother, but does not endanger the mother or the fetus. The latent phase that exceeds 20 hours in primigravida or 14 hours in multipara is called prolonged. Next, coming to the causes of prolonged labor. First one, unwrapped cervix means there is a uneffaced cervix, malposition and malpresentations. Means there may be occipito posterior position and breeze presentations, cephalopelvic disproportions, and premature rupture of the membranes means early rupture of the membranes in early stage, abnormal uterine contractions, contracted pelvis, and also congenital malformations of the baby. These are the causes of prolonged labor, and in the next slide we will discuss in detail. Coming to the causes of prolonged labor. In this causes of prolonged labor divided into first stage and second stage. In first stage, again divided into three types: fault in power, fault in passage, and fault in passenger. First, we will discuss that fault in power. Fault in power means the mother is not able to bear down. Means because of abnormal uterine contractions such as uterine inertia or incoordinate uterus contractions. Next, coming to the fault in passage means there may be some problem of passage means contracted pelvis. There may be a problem of cervical dystocia, pelvic tumor, or even full bladder. Fault in passenger. In that, malposition and malpresentation. Malposition means occipito posterior, Presentation means any breach, shoulder dystocia. Next, congenital anomalies of the fetus. There may be a big baby and other causes also responsible for the prolonged labor. Early administrations of sedatives, analgesics before active labor begins. These all are the causes occur in during first stage. Coming to the second stage, causes of prolonged labor. In that also divided into three types: fault in power, fault in passage, and fault in passenger. Sluggish or non-descent of the presenting part in the second stage is due to first one is fault in power because of uterine inertia, inability to bear down. We already discussed epidural analgesia and constriction ring. Coming to the fault in passage, in that cephalopelvic disproportion means android pelvis or contracted pelvis and soft tissue pelvic tumor. There may be a tumor in the pelvis and undue resistance of the pelvic floor. These all are the causes of fault in passage. Next, coming to the fault in passenger. Okay, in that malpositions and malpresentations. Already we have discussed that malpositions means occipito-posterior, malpresentations means breech, face, brow, and congenital malformations of the baby means big baby or any other hydrocephalus, macros